Hi, my name is Dr. Buthainah Shunnar, and I'm a consultant plastic and reconstructive surgeon. 1 in every 8 women in the US is diagnosed with breast cancer every year. With the diagnosis of breast cancer comes the fear of losing one's breast, which definitely affects a woman's identity and can be very scary. A mastectomy involves removing the breast tissue and usually also removing the nipple as well. Nowadays, the surgeon aims to try to save some of the skin in a mastectomy, and that's called a skin-sparing mastectomy, when a reconstruction is performed at the same time. And the reason for that is that it creates a more natural look with the reconstruction. Reconstruction essentially involves creating a new breast which matches the other side. The goal is to create breasts which are symmetric with each other. This may involve lifting the other breast or the normal breast, augmenting it or even reducing it such that it creates symmetry. The reconstruction is either immediate, which is performed at the same time as the mastectomy, or it can be delayed, where it can be performed, for example, several months to even years after a mastectomy is performed. This usually involves 3 stages in reconstruction. One is to create the actual mound which matches the other side. The second stage, which usually occurs about 3 months later, where a nipple reconstruction is performed under a local anesthetic. This is done by just recreating the local skin to create a nipple which matches in position and size as the other side. 6 weeks after this, a tattoo is performed by a tattoo artist to essentially match the color to the other side. There are 3 options available for breast reconstruction. The first option is using an implant alone. The second option is to use the back muscle. And the third option is using the tummy muscle and fat. In terms of the breast using an implant alone, this can either be done in 1 stage or 2 stages. The single stage reconstruction, we usually require the aid of a mesh to create the symmetry with the other side, and a 2-stage implant reconstruction requires a temporary expander replaced finally by a permanent implant several months later. Now, implant reconstructions are excellent if they're done on both sides. So if it's a bilateral reconstruction, the implant works the best because you can create really nice symmetry with using the same implants on both sides. The latissimus reconstruction, which involves using the back muscle and fat, the muscle and fat are brought forward, and if there's enough fat in the back, no implant is required, but occasionally we need to add an implant under the muscle to match the other side in terms of volume or even shape. The third option is called a tram, which involves the abdominal muscle and fat, and it's essentially like doing a tummy tuck, except you can then, instead of throwing away the fat, it's brought up to the breast and then shaped to match the other side. The advantage of the tram reconstruction is that it does not require an implant.